Hi, we are going to talk about one of the most deadly disease which can affect us, which is known as stroke. So what is stroke? Stroke is basically disease which affect the blood vessels which are going supplying to the brain. So two things can happen. Either the blood vessel can get blocked by a clot or it can burst to cause bleeding of the brain. Whichever way, the part of the brain doesn't get a proper amount of oxygen and other nutrition and dies. And it's a very deadly disease and third most common cause of death and disability. So what do we mean when we say time is brain, and what we want to convey basically that the stroke is an emergency? Every minute a stroke is untreated, the average patient loses 1.9 million, 19 lakhs neurons, 13.8 billion synapses, 12 kilometer axonal fibers. Each hour the brain loses as many neurons as it does in 3.6 years of normal aging. So while on the other hand early treatment in first few hours can reverse stroke in many patients, and it is such a common disease, 1 in 6 people will have a stroke in lifetime. So how can you know that some stroke may be happening to you or to your dear and near ones? So just remember fast. What do you mean by fast? Fast is face, arm, speech and time. Face means if the face is twisted and there is a drooping on one side of face, you know stroke may be happening. Arm is you tell them to lift up both their arms. If one of the arms they are not able to lift up and it drifts, you know there may be stroke. Speech, when they cannot repeat a sentence or their speech is not clear and looks garbled, then you know it may be happening stroke. Then don't think time is most important. You have to rush with an emergency and go to the hospital. And what should you do? Same thing. Immediately go to a hospital, not to every hospital, as a hospital which can actually is evolved enough to do a specific stroke treatment, thrombolysis, stroke interventions. Do not wait for improvement that, okay, let's wait for a while, then only go to hospital. You should rush because the sooner the treatment is done, the better the recovery is. Just don't take BP medicine and wait for blood pressure to reduce. That is not the cause of these kind of symptoms. And if CT scan doesn't show any bleed, one should take an aspirin tablet. But the key is an ambulance and rushing to a proper hospital. But can you prevent stroke? We all know prevention is better than the treatment. So 80% of strokes are preventable. If you remember just simple 7. Manage your blood pressure, eat better, eat more of fruits and vegetables and healthy, get physically active, exercise every day, lose your excess weight, lower your cholesterol level, reduce your blood sugar and don't smoke. So these are the key things, and the blood pressure remains very important in this whole management. But is it possible to reverse stroke? Yes, with modern treatment methods, we can actually reverse stroke. The blocked blood vessel, which has caused the decreased blood supply and a paralytic attack that can be opened up, then the brain tissue can be saved and help in patient recovery. If the patient comes within first 4.5 hours, we can give clot busting TPA drug and to open up the blood vessels. And nowadays, blood vessels can also be opened by intervention technique. When the clot is large or TPA cannot be given, then a neurointervention can go through the leg blood vessel and by a special device take out the clot to open up the blood vessel, and many of these patients can actually make a complete recovery. And this is a picture showing how there is a special stent-like device which can engage a clot and take it out of the blood vessel to save you or your near one. So just a message from Stroke and Neurovascular Intervention Foundation that please act fast in stroke and go to a proper hospital. Thank you.